I'm confident that we are as prepared as you can be in a fluid situation. It seems like every day we learn something new and about handling this virus. And so as it may be necessary from time to time that we come back to today's final answers on how we contain it, how we isolate it, how we treat it, how we treat ourselves to make sure that we contain any potential spread. And so this may not be the last. I hope it is, but this may not be the last. But we need to be ready to reorganize anything as new information and new treatment or new operational protocols come about.
For the last month, we have been diligently organizing the healthcare system to respond to this, the potential of an outbreak here in Idaho. This is a team effort that includes all of the hospitals, the emergency responders, as well as educating all the clinics and all of the first-line health care workers so they can properly identify individuals who may present to them with a disease state that would be consistent with Ebola.
We have not had any cases of Ebola in Idaho, but it is really important that we take this opportunity, learn from what's happened in Texas, and remember that even though things seem to be resolving there, that diseases such as Ebola are truly only a plane ride away. We need to continue to work on preparedness. I think the hospitals are very wisely looking at their capacity. I know our emergency medical providers are looking at their capacity to mostly to keep the healthcare workers safe. The general public has little to fear from Ebola. It is not easily transmitted person to person, but healthcare workers do need to take very strict precautions, and I think they are learning a lot. We are watching, guidelines are changing frequently, and we are trying to stay on top of that. It is important we also realize that even as the situation in Texas resolves, that it could be tomorrow that we are faced with a new situation here in Idaho.
We have a very strong protocol in place to deal with a person that is suspect of Ebola, that deals with flu-like symptoms and someone coming from a target place in the world where Ebola is at. And then we have a very specific response protocol and how we'll respond to that here in Ada County. We have equipment in place. We have additional equipment that's on order that should arrive later this week, where we'll be able to further protect our responders and a patient that may be affected. And the state regional response hazardous material teams are acutely aware of this and monitoring it closely, and this week we'll have a conference bridge call with all the teams and the Bureau of Homeland Security to further discuss this and our response capability. We also have a meeting with Boise Airport and Central District Health Department of Health and Welfare to further discuss our response capabilities at the airport to manage anybody who potentially comes.